Hey everybody, it's Rob from the 411 here with the 411 for the 719 podcast, and I'm here today with Travis Bockenstead, for the CXO, the Chief Experience Officer for Pinnacle Advanced Primary Care. Hey Travis, how you doing, man?
Hey, it is awesome to be here. Thanks for having me on the podcast. I love what you guys are doing on the Facebook group.
Thank you. We would love to have you here, and I'm really excited about this conversation too because we were just talking beforehand about relevant topics to the community, and you pointed out that healthcare is a very often asked question in the group. And one of the things I'm trying to do with the 411 is bring some intentionality to and get ahead of conversations like this. Like if we see this, have folks such as yourself on there that can really help people and provide relevant, timely information. So I'm super excited. Uh,
Absolutely.
Thanks. Cool. So tell me, Pinnacle Advanced Primary Care. I checked out your website, but tell me what you guys do.
Yeah, so Pinnacle Advanced Primary Care is a subscription-based primary care practice with clinics in South Denver and Colorado Springs. And basically what we've done is we've taken the primary care system, carved it out of insurance, and we allow consumers to go direct to their provider with no middlemen. What does that mean? It means we're able to deliver a much better healthcare experience. I think all of us are used to those 45-minute waiting room times we spend with our doctor, and then we get 5 minutes with them after we've been waiting 2 months to see them. So that creates a lot of frustration. So basically, for a fixed monthly membership fee, they get unlimited access to primary care and family medicine with no co-pays, deductibles, or office visit fees. And we currently work with 120 companies in the Colorado Springs and South Denver area to provide our primary care to their employees.
So I got to ask, how is that possible? How did you how did you how did you how does this model come to be? How is this possible? When I think about the cost of health, or from my
Yeah.
understanding, the cost of healthcare, how can you make that affordable to me without insurance? My daughter and wife were in the hospital. Uh, Not it was just a couple of years ago, but I can only imagine the cost now. But an overnight stay cost us $23,000 without insurance. I would have been toast. How is it possible?
Yeah, so I think the thing for the consumer is to understand is the difference between primary care and major medical. So at Pinnacle, and any good primary care office should be able to take care of about 90% of your everyday medical needs. And what we want to do in the primary care system, which I believe is the most important part of our primary care system, is help people prevent expensive downstream costs in their life later in life. So we want to keep
Gotcha.
you happy and healthy. The issue is that people have trouble accessing their primary care physician. So the only way for them to get health care is through the ER or urgent care, which is very, very expensive. Now, when we talk about major medical, Pinnacle does partner with consultants. There's a lot of them that we see on the 719 Facebook group where they fill the 10% that we don't do. So you went skiing and broke your leg, you got cancer, things like that. So the cool thing is, though, is that our members have kind of two different options. We work with health shares, which some people have heard about on the group, and then we also do work with major medical plans. But imagine for a moment that you use your insurance card. This is a perfect example from one of our members. They had Pinnacle plus insurance. She got lab work done. The lab work through her insurance company was going to be $2,000. She was going to be responsible for 400 of that. We did the same lab, used the same facility, and got her that lab for $50 cash.
Wow. Wow.
So we're really trying to retrain the consumer on how to think about healthcare. We think our insurance card is healthcare. It's not. We at Pinnacle provide healthcare. Your insurance company provides a mechanism to pay for healthcare expenses. So we're just trying to retrain the consumer to say, hey, we all need major medical, but why don't we start thinking about how we're spending our money in the healthcare system? And we try to educate our consumers to help them with that. I know that's a long answer, but I hope that kind of fills the gap between the role we play and the role major medical. But to give you an example here, at Pinnacle, we have two types of memberships. We have business, and then we have retail. I'll focus on business for a second. If you're a business owner in town, you can get Pinnacle for $68 a month for unlimited primary care. And then we have tiers for member spouse, a single parent with children, and then a full family plan. And the full family plan is $175 a month for unlimited primary care for your whole family. And then we have the retail memberships, which are a little bit, probably $5 to $10 more per month. But it's that idea to say, hey, if I start adding up all the co-pays I'm paying through my insurance, Pinnacle might be that better option for my primary care because I can get way, way more out of it. So that's kind of how we work with our customers with Pinnacle and then with Major Medical.
That makes sense. Just changing the paradigm. Kind of Zillow. Zillow has changed the paradigm for the way people shop for houses.
Absolutely.
There's okay, that makes sense actually. And I wasn't internally separating urgent care from primary care, probably because I've been trained to think about only healthcare from I'll tough it out until I got to go to urgent care or the ER.
Yeah.
That's a
And
good
we're
point.
all trained that way, unfortunately. I tell people we've been indoctrinated by insurance companies for the last 30 to 40 years. And really, they're trying to practice medicine without a medical license. And they're trying to tell your doctor when they cannot treat you, what they'll approve, and all that stuff. So we're just going around it. But the bigger picture of this is like the why. Why does Pinnacle Advanced Primary Care and the direct primary care movement exist? We've got to look at our primary care physicians. They are burning out. We're looking at a shortage over the next decade between 20 to 50,000 primary care physicians. They're having to see 20 to 30 patients a day for 5 minutes a piece, and it's not what they want to do. But because they accept insurance, that's what they have to do. At our practice, because we do not deal with insurance companies, that cuts 40% of our overhead out. If we wanted to accept insurance, 40% of our revenue would go to billing you.
Oh, wow. Wow.
Yeah. So that's how people ask me, like, Travis, how can you do a membership for $68 a month and make a profit? Well, we just cut everything out that does nothing to benefit you. And once we cut that out and restore the doctor-patient relationship, we can do some really cool things.
Yeah, it's changing the framework. It's recalibrating the framework, restarting, re-educating the consumer to say this is possible.
It is.
Wow, that's awesome. How did you get your start in this industry?
Yeah, so I wish it was a happy story to talk about how I got into this industry, but I was like a lot of folks that are on your Facebook page. They're reaching out and going, I need help, for something. I need to find affordable healthcare. How can I find an affordable counselor? Who will take my Medicaid or Medicare or insurance plan? So all these barriers for us to be healthy. So for me, I'm 36 years old. My birthday's coming up on June 6th, so I'm about to turn 36. But let's reverse back 6 years. I moved to Denver, Colorado with my partner 7 years ago, and I owned a production company, and I moved it here to Colorado. Now, as a young entrepreneur and working on some very large accounts in Colorado, it was very, very stressful, and I suffered executive burnout really, really early in my life. So the day after my 30th birthday, I had a massive panic attack that was related to anxiety I wasn't treating. I wasn't taking care of my mental and physical health. Everything was about business, and my body was finally like, happy 30th, I'm crashing. Well, two things happened. One, I didn't have a primary care doctor I could count on. I did not have anyone in the area who knew my health history, who I could have visits with. And your primary care doctor actually can do a lot to help you with your mental health. They're not going to be your therapist, but they can help prescribe medication. They can help you with some modalities to help you. I had none of that. At Pinnacle, we call it health confidence. 70% of people do not have the confidence to manage their own health concerns and conditions, and that's why they end up in the ER urgent care. I was one of those people. My ER visit, my 9-hour ER visit, and the heart monitor they put me on cost $26,000, and my insurance didn't cover any of it because I was not admitted to the hospital. So that was my breaking point. I was done. So I started Googling doctors who do not accept insurance because I knew insurance was one of my issues and I needed time. So I found this movement called the direct primary care movement, and it's exactly what it is. Direct to primary care from consumer to doctor. And I thought it was too good to be true, like many people say to me. And I had my first visit was 90 minutes long with my doctor. And in that first
Wow.
visit, we found out that two of the mental health medications I was taking were interacting with each other, so they weren't working. I was on a beta blocker I didn't need to be on. So it was really like retooling me, basically. And within 60 days, I made more progress than I had in 5 years with my mental health. So I knew the impact it could have on me, and I wanted to be part of this movement. And, I've worked in this space for almost 5 years now. And the last 2 years have been with Pinnacle and helped start this company from the ground up.
Oh, that's awesome, man. So I have to share with you in 2018, I was in a very similar position where everything was all business all the time, and just one day, one morning, I was actually in a class learning to program, and because I always wanted to learn to program, and I wanted to build tools, and some of which you've seen me employ. But long story short, I got a text message from a client who was very hostile that morning, and I
Mm.
read the text message and I said, "Ah, that's not very nice." And I turned it
Yeah.
over, and I set it down. And I said, "I need to just take a second. I need to process that before I reply." And within 90 seconds, my hands were shaking, and I was like, "This is
Mm.
weird." And within about another 45 minutes, I was having chest pains,
Oh,
and I was
yes.
like,
Yep.
"What's going on here?" And I thought, "I'm having a heart attack, right?" And I promptly stood up in the middle of the class I was in, and I said, "I need to go to the doctor. I think I'm having a heart attack." And they were suitably alarmed, and
Yes.
they were like, and I said, "That's okay. I'm going now." And I drove myself, which in retrospect was not a good thing. But I think the urgent care was right down the road. And I walked into the urgent care and I said, I think I'm having a heart attack. And they said, okay. And they were suitably alarmed and got me back to the
Yep.
EKG. And, they did that well that they did. And then a little while later, the doctor comes in and he's really nonchalant about it. And I'm thinking, I'm having a heart attack. And this guy's really nonchalant, right? And he goes, "So tell me what's going on in your life." And I said,
Yes.
"Well, I believe I'm having a heart attack." And he said, "No, no, your heart's fine." And I said, I don't know, doc, left side, shooting pain,
Yep.
And he said, "Right." He said, "You're having a panic attack." And I said, "No, doc." I said, "With all due respect," and I mean this with no arrogance, but I said, I'm 20 years in the military. I have been in alarm red in Iraq, bombs going off, people screaming. I said, I don't panic." And he said, "You're panicking." And I said, "No, no, sir, I don't panic." And he said, "Listen, I'm the doctor. You're not a doctor." I'm looking at the report, and he said, "Your heart's fine." And he said, "Tell me what's going on." And he spent some time with me actually, uh, I mean that was the longest doctor visit I've had in 46 years, and
Yep.
from that emerged same thing. I was not doing what I needed to be doing for myself and
Yeah.
taking care of myself, and it caught up to me, and that's so since then I've been trying to do some things that I should be doing.
Yeah.
But to your point earlier, I am still going it alone. I don't have a medical practitioner. Chat GPT right now is probably the closest thing I have to a medical practitioner.
Right.
Uh,
Right.
but even so, I have TRICARE. But even sometimes, not complaining about the system or anything, but I've tried a couple times to figure out, okay, how do I get a primary care physician on TRICARE? And I don't know. And to your point of people don't know the healthcare confidence thing you mentioned, I don't know what I need to even do, and it gets so
Right.
complicated so fast that I'm like, okay, I got to find somebody who takes this, and but they're going to move, or I don't know, and so I don't know what I don't know.
Yeah,
And
it's very frustrating, and people just want to be healthy, and everything you described is exactly what I had. I was in denial. I'm like, I can handle so much stress, but at some point your body, it has a choice, and sometimes it just needs to give you a hard stop. And yeah, and that was my turning point.
that's inspiring that you took the action on that. You said, okay, I'm going to turn this into something. Uh, my next question is, what unique or innovative approaches does your business have? We've been unpacking that since the start here.
Yeah.
That you've turned the you've I think you're coming at it actually from probably a Ray Dalio first principles perspective.
Hmm.
Starting way over here, deconstructing the problem and coming at it from a whole different perspective, such that I imagine the other thing you said, people don't. You probably get a lot of disbelief. No, you can't possibly. This can't be true.
Right.
$68 a month or $75 a month, and you're going to
Yep.
provide me with a primary care physician. Is that
Yeah.
okay?
Right.
Any
Right.
other unique or innovative
Yeah, that's
approaches you think
spot
you use?
on. I would say the thing we focus the most on at Pinnacle is transforming people's health concerns into health confidence. And we do that through strong doctor-patient relationships, convenient access to care, and cost-effective treatment options. These are the three things that people want out of the healthcare system. And by breaking down barriers, by reinventing the system, by putting the patient and the doctor first, not the middleman, we can do some really cool things with the healthcare system. There are just so many big things that dictate our healthcare system, and there's a lot of gross incentives out there. Dr. Diger, one of our co-founders and CEO of Pinnacle, will tell the story of when he was working at a hospital, and the CEO called everyone together and was basically like, I need you to order more MRIs. And he's like, why? And he's like, because that's how we make budget. So it's that idea of how is your healthcare provider and system incentivized? And if it's incentivized to do as many procedures to you as possible to get paid, then guess what they're going to do? They're going to do as much as possible to you as they can so they can make the money. I tell people all the time, about 95% of our revenue comes from membership. We do not get kickbacks from anyone. So either you like Pinnacle and we're providing a great healthcare experience, or you cancel. So in order to create a free market healthcare system is what we need. We need disruptors like us. And the number one thing is we need price transparency. Healthcare is one of the only things you buy where you don't know the cost and you get the bill after the fact. That's insane. How many, if you went to the car, get your car worked on, and they said, yeah, don't worry about it, we'll send you the bill in the mail. Like, no one would do that, right? You're going to want to know the cost up front. So, that's what we're really trying to do at a high level.
My daughter wears hearing aids, and the cost. So one time, I dropped one of those hearing aids and asking her to take them off. I always have her hand them to me, and I put them in my pocket, and there was a little fishing line attached, the clips, and my phone rang right after I put them in my pocket, and I pulled my phone out to
No.
answer the phone, and it caught the edge of the clip, and it flipped the hearing aid up in the air and went
Oh,
kerplunk into the lake, which was not clear water. And so instantly lost. And I said, well, darn it. And I called the insurance company. I called the people that make the hearing aids, and they said, we can't sell it to you direct. And I said, I mean, why
are
not?
you
And they said, well,
serious?
I'm serious. And they said, we can't sell to you direct. We have to go through your insurance. I said, well, what's the cost of that? Because I'm going to have a copay, right? And I believe if it's even covered, I don't know if it's even covered. And they said, well, it depends on your insurance. And I said, wait, the cost depends on my insurance. And they said, yeah, it could be
Yep.
anywhere from $500 to $5,000. And I said, just a minute here. You're telling me that the cost is variable on this thing, and you can't sell it direct to me. And yeah, so I ended up going through the audiologist, who was able to actually. Coincidentally, we were like 5 days out from the expiration of the warranty, and we were able to make a warranty
Oh
claim
gosh.
and get it back filled. But
Wow.
it was weeks and weeks worth of effort for a hearing aid, and talking to the variable cost. And also, you talked to the disruption thing. One thing I think about a lot is what we're doing from healthcare to a lot of other things. It's just, to
Mhm.
me, it seems not sustainable. This is literally not
Right.
sustainable.
No,
And
you
so
are
you're coming.
absolutely right. And you as a consumer were trying to be a good consumer, right? You wanted to know what your cost for this procedure or for this medical device would be. And I have a similar story, that the heart monitor I was put on. I asked and asked and asked. I was like, how much is this going to cost? $500. Okay, great. I had to wear it for 6 days. Miscoded. It was 1,000 a day. So I paid
Oh, geez.
$6,000 to wear a heart monitor. So you can see my surprise and frustration when I was like, wait a minute. And then he came back with the same thing. Well, based on your network, based on your insurance, based on your copay. And I'm like, this is ridiculous. I want to pay you cash. I do not want any more surprises from my insurance company. And that's one thing we encourage all of our customers to do, all of our members to do, is to ask for the cash rate, because it may be less than your insurance card. Sometimes it's hard to break away people from their insurance card sometimes. And what I tell people, the main reason insurance exists is just to protect you from bankruptcy. It doesn't guarantee you care delivery. It doesn't guarantee you what you want, at the end of the day. So it's really kind of, like I said before, shifting how we think about it. And you've had some very similar experiences that we hear about all the time, unfortunately.
So without going too much in depth, my daughter has had to have some ear surgeries, and
Mm.
we had a situation in 2015, I think 2015, 2014, where the doctor took us as a cash patient, because to get us at that discount rate, I suppose. But our insurance company said that they would pay for the procedure, right? And so after we got the first year done, I got a hold of the doctor and got a hold of the insurance company, and the insurance company said, "Sure, send us the bill and we'll backfill the cost," right? And I said, "Great." I got a hold of the doctor. The doctor said, "Oh, I can't give you the bill coded like they're asking for, because I took you as a cash payment." And she said, you're going to file for reimbursement from your insurance company, aren't you? I said, "Absolutely. They told me to," right? We're talking about $35,000 per year. And,
Wow.
yeah. And, she said, "Well, I can't do that. That would be insurance fraud." And I said, No, you don't understand. The insurance company is telling me to file, and so I just need this coded bill." And she said, "No, you don't understand.
Yeah.
My attorney says that since I took you as a cash payment, I cannot give you an insurance billable invoice." And I said, "That makes no sense. And would you talk to one another?" And neither. No, they said, "No, you're our guy. We have to talk to you." You can't. And I went to the legal office on base because I was active duty at the time. And I said, "Hey, what can I do here?" And a friend had suggested going to the media or going to GoFundMe or something. And the JAG office told me, "Be careful." I said, "It was actually good advice." They said, "Who's wrong?" And I said, "I don't know what you mean." And they said, "Well, neither one is wrong. So who are you going to call out as being wrong, right? And if this gets picked up in the news, be careful because somebody's going to get vilified, and who's wrong? It's not the insurance company. They're telling you. It's not the doctor because her attorney is saying." So I said, "So what do I do here?" And I tried to. In the end, we sucked up the cost, and but it just because it's so complex and so many layers. And let me ask you, what services do you cover?
Yeah, so included with the membership, and Dr. April Lynch, another one of our co-founders, our chief medical officer, puts it a really great way. So when you sign up with Pinnacle, you basically get an all-you-can-eat primary care buffet. So you get a ton of services. And I say it's also kind of like getting a Costco card because everything in clinic is wholesale cash pay. So primary care, family medicine, unlimited virtual care, on-site pharmacy and lab, minor procedures such as stitches and mole removals and skin biopsies and stuff like that, men's and women's health for your kiddos. So all those basic things you need to stay healthy, and the things that are uncomfortable like UTIs and ear infections and stuff like that. No one should have to wait, for days in pain or have to wait at an ER urgent care to get those things taken care of. So we do all that in office. We do not accept walk-ins, and we do not do one-time visits, because if we did that, it would take away the ability for us to service our paying members. So if you're a paying member, you can get same-day, next-day visits for your acute needs, and you even have the ability to contact your care team after hours, which is really great. Then we have in-clinic medications. So for us, we have an on-site and mail order pharmacy. Through our mail order, it's about $10 for a 90-day supply of medication shipped to your home, cash. A full annual lab work up with us is about $12.50 cash. If you go to a local laboratory and get the same lab, it's around $170. Again, same lab, same everything, same needles and blood tubes. It's just how is it reimbursed for? Trying to think some other things. I mean, we call it cradle to grave family medicine, that idea of we're taking care of baby when they come into the world and we're helping your grandparents through hospice. So, that's what we do at the end of the day through that membership. And like I said before, then we help our members navigate some of those major expenses. Like maybe doctor says you need to go to a specialist. We're going to help them shop around. Yeah, we're going to help them shop around town to find the best specialist. We've actually started our own cash pay directory. It's our nonprofit arm of Pinnacle. It's called cashforcare.com, all spelled out. And we have over 30 cash pay healthcare providers in Colorado Springs on that directory. So, physical therapy, for instance, it can be really limiting with insurance. You get to a certain point of mobility and then they cut you off. Well, we've got physical therapists who are cash pay. Maybe at the end of the day, you might pay $50 more than you would with insurance, but they're helping you recover in a short amount of time and they're giving you longer visits and more care. So
Not to
what
mention,
I,
the cost of dealing with the insurance company. If it takes me 16 hours of
oh,
coordination with the insurance company, that if it's $50 more, that 16 hours was well worth $50.
you brought up exact next thing I was going to say. If you believe
Okay,
your health is your wealth and your time is money, then Pinnacle is a great place to start because it's all about maximizing your time. You shouldn't have to run around 10 different places to get care. Pinnacle becomes your quarterback. We're the ones that, even though we're not going to do your specialty visit, we're the ones that are going to make sure you get there. And we're going to say, hey, how did that specialty referral go? Because we need that information back into the clinic to make it part of your care plan. So, our patients have their own personal responsibility that have to be active in their health and wellness, but we're here to do a bit of hand holding and navigating through the system. And our members find a lot of value in having that.
that's awesome. So if you go to the doctor and the doctor says, "Hey, you need some specialty care," do you interface well with an insurance taking provider, or how does if for example, my daughter's years, if needed something, if I was enrolled in your plan and we needed something more than the primary care physician could do,
Mhm.
would you be able to interface with that doctor who does provide insurance care, or how does that work?
Yeah, yeah. And it would be up to you, kind of the member, right? It
Okay.
would be, hey, we've got some cash pay folks who could do this. They also accept insurance. Some of them do. So it's kind of really finding out, working with a member to say, hey, what is your financial liability for this procedure, this visit, etc., cash or through your insurance? And as we've discussed, that rate can vary greatly. And for a
Yeah.
lot of people, does not make any sense why our $12.50 lab will cost $170 somewhere else.
But
So the other,
it kind of, I think we've been trained to, I know in real estate, there's something that says you get what you pay for, right? But that
yes,
mantra does not factor in things like, I happen to have real estate, and so I have a pension from the military, so I can afford to flex where others might not be able to.
sure.
But we've been so trained to think that dollars equals quality. Period.
That is not true in healthcare. And, I think we see a lot of these big health systems building what I call a palace of wellness. And the atrium is like bigger than the hospital itself. So it's this, we've been marketed through insurance companies and through big healthcare who have millions and millions of dollars to spend. And magically, some of them are nonprofits, which confuses me altogether. But they have a lot of money to spend to say, hey, come to our glamorous facility. You're going to get the best care on the planet. And that may be true, you know, but at the same time, you shouldn't look at our lab and go, ooh, $12.50. That's can't be a good lab. It's like, no, we use the same facility. So as consumers, cost is not directly related to quality in the healthcare system.
Right on. What's the vision? What's your vision for the future of your business?
Yeah, so it's been a while, 2 years. So this month, June, was our soft launch date. So
Congratulations.
for thank you. So for 2 years, we've been in business. We had our grand opening in September of 2021. That would put us at 2 years, right? But in basically the 2 years since we started in June 2 years ago, we have gone from one clinic. So our original clinic is off of Cheyenne Mountain Boulevard. We then launched a clinic at Skyridge Medical Center in Lone Tree a few months ago. And we are set to open clinic number 3 at Briargate Medical Center on July 11th. So we're moving furniture in right now. We've got the paint on the walls. So we're now able to service the entire Colorado Springs and from South Denver through Castle Pines and Castle Rock. Future goals, I would say, is we want to franchise in the future. We want to make this model a way that physicians can leave traditional insurance-based primary care and we can support them to be part of the direct primary care movement, get their clinics set up, help them with marketing and business development. So our goal is to continue to make this a sustainable model. There are over 1,000 direct primary care practices across the country. The latest I heard is that we have 20 plus million people in the United States enrolled in programs like ours. So,
Wow.
the subscription economy we've seen works. You've seen cable companies. Everybody hated them.
Oh,
Everything
well,
about it, right?
everything has gone to some music.
Right.
You remember Napster? You might
Yeah.
be just okay.
No,
Do you
I do.
remember Napster? Okay,
I do.
okay,
Yeah.
yeah, no,
Yeah.
everything to the music on our phones to cell phone plans to they're
Yeah.
without a cell phone plan, it's a brick.
Right.
Yep.
Right. Exactly. So we're just taking that as subscription economy, which users like. I know what I'm paying, and if I'm unhappy, I can cancel at any time, which I think most subscription services run from. If you use YouTube TV, you get your food box delivered. So we're taking that, what the consumer likes, and we're making it very easy for them to purchase and access healthcare. And so, and two, you know, the way we can make the biggest impact is partnering with employers. The American dream is being stolen by big healthcare and outpriced services. You can't afford to give your employees a raise, or you do, but the health insurance premium goes up 5% next year and it's a wash, right? So the next thing we're trying to tackle are bigger employers. How can we provide such a great primary care experience that their employees aren't going to the ER and urgent care for UTIs and ear infections? You might have a copay of $200 to go to the ER, but what people don't realize is your employer maybe paid $2,800 for you to go to the ER,
Oof.
right? So you've got a bunch of people using the healthcare system improperly, and it's going to drive up the cost for everybody else. So we've got to retrain the consumer, but we can't do that until we improve access and cost.
You might not know this, and it's not putting on the spot. But, what is the requirement in Colorado for providing health care to an employer or to employees? How many employees do you have before you have to have a healthcare plan?
So really, we look at the 50 benefit eligible employees. So once you
Okay.
hit the over 50 mark, you are looking at much stricter compliance. It has to meet the minimum ACA or Obamacare requirements. If you are an employer with less than 50 employees, you can be a little bit more flexible in your plan design for your business. I'll give you one example. I had a member I spoke to yesterday, and they through their company plan were paying $1,700 a month for their family with like a $7,000 something plus deductible. So that's out of reach for a lot of people. So if we can help a small business and say, hey, you can do Pinnacle, you can make sure your employees have access to all their everyday medical needs to keep them happy and healthy. And here's the cost, from 68 for like I said, for an individual, 130 for a couple, 130 for a single parent and unlimited kids, and 175 for a whole family. So boom, now you've got that covered. And for a lot of the coffee shops I work with, landscapers, contractors, this is awesome. It gives them a way to
Yeah.
retain and to keep their employees healthy. And the best part, unless we have to, it doesn't mean an employee has to take a whole day off work just to go to the doctor. That's ridiculous. We should be able to, if we can do a virtual call, we can do that. So that's how we're helping businesses on that side. And then we work with the health share that's super, super affordable for people who qualify. And like I said, we also work with those higher deductible health plans. But I tell people, start with Pinnacle. Start with Pinnacle for your benefits, because we're not getting any gross incentives to sell you something. We're going to sit down with you, talk about your health and wellness needs, and we can help you navigate to the right person in town to help you with your dental vision, to help you with your major medical. So, we're a really great place to start if you're lost and just needing someone to educate you and help you with benefits. You don't need to be a member to do that. Obviously I hope they would like what we do, but our number one goal is just to help people navigate.
Is there a minimum number of employees an employer in Colorado has to, or can, is there a minimum that above that you have to provide healthcare?
No,
Okay,
really it's around that 50
employees.
benefit eligible
Okay,
lives, employees
uh,
is what you're looking at. And
okay,
for a small business, some plans do require like 5 unrelated employees to do like a business rate. For Pinnacle, we made the decision on day one that we were going to give a solopreneur, self-employed person the same buying power as a company with 50. So if you're a solopreneur in town, you run your own family business, you can get the business discount with Pinnacle.
that's awesome. I was just trying to run some numbers in my head and thinking, if I had 50 employees and 20 of them visited the ER, that's $40,000. That's a potential $40,000 copay. That that as a business owner,
Yeah,
that would crush me.
right.
Potentially
And
crush me.
there
Depending
are
on
businesses, there's many different ways to structure a health plan, but one way that's structured is called a self-funded health plan. And essentially at the end of the day, the employer assumes the responsibility for everything beyond what you pay in your premiums and copays. So, you know, so if we can prevent those downstream costs from hitting, imagine what an employer can do now. You know, they may not be looking at a rate increase next year. They may be able to convert that 50,000 they would have blown on improper use of the healthcare system and say, hey, we can do capital improvements. We can expand our benefits. We can pay our employees
it,
more
I was just say give raises, right? Yeah,
and get
that's
raises.
incredible, man. So what's the biggest challenge you face right now?
40 years of insurance companies telling us how to experience healthcare, and the amount of
It's
money and
institutionalized.
lobbying institutionalized. Yeah. And I think that the consumer wants something different, but they're nervous to try something different. So
Totally.
yeah, which I understand, but I would just encourage people, you know, healthcare is one of the most expensive things we purchase. We as consumers just simply cannot look at the number and go, it's the lowest premium, I'm good to go. You need to put more effort. You need to take personal responsibility to start researching and educating yourself about the US healthcare system because we spend way more money than any other country. Most developed countries are spending about 5,000 per person. We're looking at about 11 to 12,000 now. So we just need to be more active in this, and we cannot rely on our government and taxpayers to shoulder the burden for what big healthcare companies are doing to this country. So it's really up to us. You could put a billion policies in at the end of the day, but if we go back to your example, when you're asking for a cost and no one can give it to you, then we have no way to put some reins on these costs for healthcare.
Isn't healthcare like the third most? You got defense spending, and then Social Security, and then it's healthcare, if I'm not mistaken, isn't it? For in terms of cost to the country.
It is, and also for companies, healthcare is often their second um, largest line item for the company. So I tell people, your company is not only in the business of selling your products and services, you're actually also in the business of healthcare. And we need to be more active. If that's such a big line item in our budget, you cannot just take a 5% increase and go, oh, whatever, that's what I get. No, that's not good enough anymore. You need to push back against your broker. You need to push back against your insurance company. And more companies need to be doing that. And I think there's a breaking point where we're starting to see, unfortunately, Friday health plans just went under. That was announced yesterday. So now we have another low cost option on the exchange going out because they can't pay their bills. So something's got to give. But I think Pinnacle and other direct primary care practices like us in town and across Colorado, I think we are well positioned for when things crumble more than they are. I think the consumer is going to finally figure out like, hey, I need to change how I purchase my healthcare, and I need to change my relationship with the healthcare system.
All right, so just you go back to the core thought. Our trajectory is unsustainable, and it's not political. It's just unsustainable. The cost of everything is just unsustainable for the average
Right.
consumer. When you look at the median wage, it's but the cost of
Oh,
everything else, the gap is
exactly.
just not sustainable. Uh, okay.
Yeah.
Uh, well, anything else you'd want the 411 to know about your business right now?
Yeah, I would speak to everyone on the page that is out there looking for healthcare. I see a lot of people all the time that are trying to find a doctor. They're trying to find someone in a network. They're trying to get better care. And what I would encourage you to do is to start to do your research and to start to expose yourself to the cash pay community in town. There's a lot of people that are out there that are trying to help, but don't just think of your Medicaid, your Medicare, or your insurance plan as your only ticket to getting care. So, to everyone out there, we're in a really special place in Colorado Springs. It's very innovative. I would say there's probably 4 to 6 of us in town that are doing this healthcare model. So, and Colorado has a really rich direct primary care, cash pay healthcare community. We're even seeing surgery centers that are giving you a flat rate for your knee replacement. So you know exactly what the cost is. It's packaged up in a package deal. So, for those of you who are frustrated, you're looking for healthcare, start with Pinnacle. We're a really great place to start if you're just confused with the system and you want someone to help you. So there is help out there for all of you looking for healthcare.
As I've started doing this podcast, I knew this, but then it's really interesting that there's so much people don't know. This wasn't even on my radar, right, until you reached out, and this is an option. I mean, I might have seen a headline or two over the last year about different
Sure.
healthcare models, but it's a whole nother layer of I didn't even know existed until today. Thank you.
Yeah,
Uh,
absolutely, absolutely. This has been
so,
really great.
oh, thank you. Likewise, we usually wrap up with a couple of funny questions here. Let
Yeah.
me ask you: do you have any hidden talents or hobbies?
So I play the saxophone. I've played it
You're like
since
the
fourth
saxophone
grade.
man from. Yeah,
Yeah, I play the alto saxophone, and I actually just bought a new one. I hadn't played it for like 10 years, and a few months ago, I got a new student saxophone to kind of, get back into it. So, yep.
I can see you getting down with that and doing the groovy stuff. That's cool. If you could eat one food for the rest of your life, what would it be and why?
I'm a Midwest boy. I grew up on a farm in Northeast Iowa, so meat and potatoes. That's what I grew up on. So a good pot roast, and I'm happy I could eat that for years.
Right on. Okay, last one. If you could time travel, where would you go and when?
I would say the um, early 1900s when we were starting to see, technology and innovation, having the first phone call, stuff like that. I think it would be really cool to time travel back. And I'd like to know what people do without cell phones and computers to, spend their time. So I think that would be interesting to go back to that time.
I struggle to remember that time. Actually, I remember when beepers were a thing, and people carried around beepers, right? And then before that, I can't honestly can't really remember, what it was like. But I wonder for our kids too. Apple next week is set to release. They're talking
They are.
speculation that they're going to release their integrated augmented reality headset. And what I've been
Yep.
telling people for several years is pretty soon we're going to have glasses. You're going to pop them on, and they're going to be augmented reality lenses, and you're going to have a data stream that I can see and interact with my eyes, right? And then after that, it'll be contact
Totally.
lenses, and so plugged into the data stream that. And there'll be maybe you want to be known as a Viking, and so you'll have a little beacon on that for and my glasses will read your beacon and say, hey, this guy wants to be a Viking, so your Viking hat will pop on, and just as a doctor, you could walk in, look at your patient, and their medical beacon that they've is coded to your clinic
Yes.
will pop up, and it's there. You go. There's all the information. There's their kids' names, and right in your field of view. But sorry, random rabbit hole
No,
tangent there, but it's
I could
I
totally see
often
it.
wonder too what as we get more plugged in, it's going to be even further in our history for what that was not like. But Yeah, that's cool, man. I struggle whether I'd want to go back or whether I want to go forward and see where this is going. You know, what does it look like in 100 years from now? But very cool, man.
Agree.
So Travis, with
Thanks for having me.
Pinnacle Advanced Private School, thank you for being on. This is an awesome conversation, and you blew my mind with a potential. Travis from Pinnacle Advanced Primary Care. Last word is yours to the 411.
I would say, hey, this is a great page to find resources in our community. There are a lot of subject matter experts on there. Do your research, be a more active consumer, buy local. That would be my final word to everyone. And two, check us out, pinnacleapc.com. If you are interested, and if we're not a good fit for you, we can send you to another clinic in town that's like-minded and do what we do.
You're awesome, man. Thank you for your time today.